Hi there, I'm glad to be back today. And today I want to deep dive into borderline personality disorder and eating disorders. And we're going to deep dive into that today. If you haven't already, please subscribe to my channel. Give us a like here on this video if it connects with you and if the information you find helpful. Eating disorders are behaviors that an individual with BPD can use to injure themselves. Self-harming tendencies, in this case, using food. And so when we think about eating disorders, we realize that eating disorders are used to cope with things, but they're unhealthy coping mechanisms and unhealthy coping skills. The reason why an eating disorder can go hand in hand with borderline personality disorder is that, first off, an eating disorder can ultimately distract somebody from the chaos in their own life. The reason for that is an eating disorder will pull focus and attention inward. And it leads one person to be able to manipulate their body, their weight, and it's something that someone can control. And this goes back to the concept of needing or finding or wanting to create some sort of control in a person's life where they feel out of control. And that's really what we want to deep dive in today, where we think about starvation, overeating, purging, binge eating. So we're going to be talking about eating disorders, EDs, and the reason for why they are done or used as a coping skill. The first one is obviously bulimia, and in bulimia, you're throwing up after you eat. And so the concept behind that is purging one's feelings, right? Purging one's feelings, being able to throw those up, get rid of those, purge that to feel clean, to feel over those types of feelings. The second option is binge eating, which is stuffing down one's feelings, stuffing it down, eating so much so that it's trying to fill that void. The third is anorexia, and that's used, anorexia is the concept of not eating, just starving yourself. And in that situation, you're numbing your feelings. You're numbing your feelings. And the fourth is otherwise specified feeding and eating disorders. And that can kind of apply to various types of eating disorder or a combination of eating disorders. And so you have the purging of feelings, the stuffing down of feelings, the numbing of feelings. And all of this is done in a method of control, because the person that is dealing with the eating disorder can control if they eat. They can control if they don't eat. They can control if they throw up or if they don't throw up. They control how much they eat. If they want to overeat, they can continue to eat. And so these are skills used to cope with life, to self-soothe. And they're obviously unhealthy tactics they're not helpful. They're not sustainable. They're self-destructive, but they're still used. Now, it's very interesting too, because you have to look at the other side of the concept here when you're thinking about eating disorder is emotional hunger versus physical hunger. What are we dealing with? Somebody can be emotionally hungry. They're trying to feed, they're trying to stuff down their feelings. So they might not be hungry, and they're sure not hungry enough to eat all that food, to binge eat, but they keep eating because of that emotional hunger that they have. Like starvation, right? So you're actually, you need to eat and you're starving yourself. And so there has to be a hump that's jumped at some point where somebody with the eating disorder begins to eat when they're actually physically hungry instead of emotionally hungry. And one of the things that I find interesting that goes hand in hand with the BPD and the EDs is that the person that's dealing with this must learn how to self-soothe during times of emotional dysregulation. So oftentimes in situations of emotional dysregulation, this is when the eating disorder is used very regularly, because this is the go-to response. This is the go-to response when it comes to emotional dysregulation. And this is their go-to because they can control it. Whether it's alcohol or drugs or reckless behavior of other sorts, I find that eating disorders is just as reckless of a behavior, but it can feel not reckless because it can seem to be controlled, and it's not a substance or a drug. So there's a need to learn how to self-soothe in times of emotional dysregulation. And emotional dysregulation is that severe depression, severe and extreme anxiety, extreme shame, extreme anger, self-harm, excessive substance abuse, risky behaviors, perfectionism, and high conflict in interpersonal relationships. And so when we think about this concept of BPD and eating disorders, we can understand why it would be used to self-soothe. Even though it is very painful on the body and causes havoc to the body, It's a way of control. And you don't have to have an eating disorder and have BPD. You don't have to have BPD and have an eating disorder. It's not, they don't have to go hand in hand. But when they do go hand in hand, you understand why. Because of the emotional dysregulation, that's the go-to. Whether it would be the alcohol and drugs go-to, or maybe some risky sexual behavior, or gambling, or whatever that looks like. This is the go-to response for somebody that feels like they can control it by using this type of behavior. And, a lot of times, too, that might have been something that they have also seen in childhood. It might have been something that they saw a mother and father do when they were being raised. It could also be something that has gradually increased throughout their lifetime, or it could be a new coping mechanism that's used as well. So it just really depends. Eating disorders are not a long-term solution because of the damage that it does to one's body and to one's health. I hope this video has helped you or shined some light into the subject of eating disorders and the combination of borderline personality disorder. If so, please give us a like on this video. And again, if you haven't subscribed to the channel, please go ahead and do so. It makes us know that we're doing something right and creating good content. In the comment section below, let me know, is there anybody that you interact with, or a friend or family member or spouse, who uses eating disorders as a self-soothing mechanism? And better yet, also, how do you deal with it? How do you deal with it, and how are you trying to be supportive or to help them in their life? It's something that's not always talked about, but something that does need to have light shined on the subject. In the meantime, don't forget to live your true life.